Good morning. Welcome to the Institute Management Update. We're taping this on Monday, November 2nd, and it'll be airing throughout the week this week. We're going to do a couple of things. We're going to start up. Mary Morton is here, and she's going to give us a financial update with the third quarter results. Then I'm going to talk a little bit about our ongoing analysis of the COVID-19 data, and then Ross is going to finish up talking about Thanksgiving coming up and some additional dining matters. So with that, let's turn it over to Mary and get an update on the third quarter results.
Good morning. As Dan mentioned, I'm going to give a brief financial review of the performance for the 3 quarters ending September 30th. We had very excellent financial performance in first quarter, exceeding the net operating margin budget by over $135,000. Second quarter saw significant negative financial impacts from COVID-19, primarily in the Chateau. Revenue has improved in third quarter, but it's still below budget and much less than first quarter. This slide illustrates what I just said about the significant decline in revenue from first quarter to second quarter and the subsequent increase in third quarter. Third quarter revenue was still over $940,000 less, or 5.4% less than first quarter. As I mentioned in the beginning, the negative financial impacts of COVID-19 affected the Chateau most. There was a lengthy period of time at the height of COVID when the local hospitals suspended elective surgeries, which caused a considerable decrease in the short stay resident census. We've discussed in past open forums that recent growth has allowed the organization to reduce its reliance on Medicare revenue, which is advantageous considering that in real dollars, reimbursement has been decreasing over the last several years. And the last few months have proved that this strategy continues to pay off. Amazingly, net operating margin for the 9 months ending September 30th was a positive $840,000, or 1.7%. While we are very pleased to have produced this very small net operating margin, it is still $1.5 million less than the 2020 budget and much less than industry averages of 6%. Recent growth has improved net operating margin, excluding the negative effects of COVID, and Moorings Park does continue to work towards a sustainable net operating margin closer to industry averages. Moorings Park has received stimulus monies under the CARES Act Provider Relief Fund that will improve the 2020 net operating margin to a level closer to budget. We have not yet recognized these amounts as revenue, pending finalization of the terms, conditions, and requirements tied to these funds. We remain focused on being a top employer in Southwest Florida, as we know that our partners are the most critical component in providing value to residents, and we must retain our best partners during these difficult times. Many of our partners and their families have suffered financial hardship during COVID, and the money raised by the residents for the Employee Hardship Relief Fund helped our partners tremendously, and we are very grateful for your generosity. We are very excited for 2020 to end and to start the new year. And in order to set Moorings Park up for success in 2022, there are 2 key areas that must be improved over the next 12 months. And those are occupancy in both the Chateau and independent living. Recent occupancy in the Chateau and independent living sales momentum over the last 3 months has been very encouraging, but we will remain focused on improving these areas that are key to a successful 2021. Moorings Park does have the balance sheet strength to cover the negative financial impacts of COVID that we expect to continue into 2021 with reserves. Reserves are significantly impacted by stock market performance, And this slide summarizes the change in unrealized gains and losses on investments by quarter, and then annually since 2016. Morris Park's financial risk management has mitigated the risk of volatility in the investment portfolio. And as a result, the reserve balance has remained stable and has helped our organization get through this crisis. We must continue to have a long-range view, though, to ensure that our reserves remain adequate to meet our commitment of providing high-quality services and care to all residents for the rest of their lives. Thank you.
Thank you, Mary. It certainly has been a tough year, but you can see from her report, Mary's doing an excellent job. I hope you got a chance to see her budget presentation for 2021 as well. If not, please check it out on the web. I'm going to transition to COVID-19 and just go through kind of the data that we look at really on a daily basis, certainly on a weekly basis, and what our observations are from that. Here's the first one we look at. This comes right out of the Department of Florida website, and it does the positive cases, 5-day moving average is what we calculate. We don't worry so much about the daily, so that any spikes get out. And you can see all the graphs are going to look the same. A peak sometime in July, a valley sometime in late September, and then a slight uptick as we went through October and in November. On the right-hand side of the screen is the Collier County positive cases. Same exact story. Mid-July peak, a valley in late September, and now a slight rising trend. We also look at the positivity rate each week. Right now in the state, it's just over 5%. It's been as high as 12%. In Collier County, it's hovering between 7 and 8% right now. It's been as high as 15% in the middle of July. We're very proud of the Morris Park positivity rate. Overall, since the beginning of this thing, it's 1.6%. The last 3 times we've done tests, and we're doing hundreds of tests every week of partners, the positivity rate has been below 1%. And so that tells you that all these safety measures that we have in place are working. So thank you to all the residents and all the partners who are staying safe out there. The next data we look at is what are the serious health outcomes from COVID-19. And this is a slide. It's the exact same as the one previously, and it is the number of people in NCH hospital that have COVID-19 and are being treated for COVID-19. It's the same slide because you can see the peak in the middle of July where there were 144 people in the hospital being treated for COVID-19. Then you can see it fall off of that peak. It got down to 10 in late September. And since late September, we are seeing a slight uptick. And it's something we're watching very closely. It's why we continue to make sure that we're staying safe. In fact, this morning when I looked, this was updated as of Friday. This morning when I looked, it was 34 in the hospital at NCH. So it's nowhere near the peak, but there is a little bit of an uptick that's happening. Of course, the most negative outcome is deaths. And there's no denying the peak, again, early August, because death is lagging from cases in hospital. But then in the state of Florida, you can see it continues to decline all the way through even to today. On the right is the Collier County death rate, and again, it's a 7-day moving average. Because there's such a small data set, you can see it's a little bit harder to evaluate trends, but you see the same thing in early August where it looks like we went through a peak, and it does seem like a falling death rate right now. As of Friday, there were 249 deaths in Collier County. And this next slide tells you why we've taken this so seriously. This is produced by the governor's office, and it is all the assisted living and skilled nursing facilities in Collier County that have had deaths. And if you add all these up, it totals 102. So 102 of the 249 deaths in Collier County have happened in either assisted living facilities or skilled nursing facilities. A couple of things that really have us interested in this. But first of all, what this is, I'm going to repeat it. These are assisted living and skilled nursing deaths. It has nothing to do with independent. There is not a reporting source for the independent. But you can see some of our competitors up there highlighted in yellow, 7, 6, and 1, 14 deaths in the assisted living and skilled nursing facilities. Of course, we're at 0 in those things. And then the far right column is a little bit concerning as well. These are the deaths in the month of October. And you can see they're not 0. There's still some pluses up there, +2s, +1s, +3s. So this threat, at least in those environments, is still very, very real. And that's why we are continuing to take a safe, cautious approach to opening up and saying we want to open but stay open. Let's do it in measured steps. Let's open it up a little bit. Let's have success. Let's evaluate the data. Let's evaluate our data and then take the next step. We really have been balancing safety for all the reasons I just went through versus all of the residents of Moorings Park having access to the full array of amenities that you signed up for. And I just have to say thank you, because one of the reasons we're having great outcomes is, you know, you're wearing your masks, you're keeping your social distance, you're washing your hands. As we learn more and more about this, we're doing the things that we know we can do to stay safe. Believe me, we want to open up. We all want to get back to normal, but the data shows us that now is still a time to remain cautious. One of the biggest areas where access has been hard has been in the dining area, and we're fully aware of that. Here's just a little chart that shows you how much seating we have and what we have at 50% capacity. So here at Goodlet, 223 people that ordinarily, or seats that ordinarily would have somebody dining and enjoying those amenities, have not been doing it at the 50% level. At Gray Oaks, 72 seats have been unfilled, and has nothing to do with staffing levels. It has nothing to do with anything other than safety protocols and closing half of the dining room. We're taping this the morning of November 2nd. We're very excited about opening up more tonight to 75% in most of the dining rooms. We know residents are all over the array of feelings about that. Some people are still not ready to come to the dining room, so we're going to have home-delivered programs of various types. Some people think 75% is too fast. They want a 50% option. We're going to keep one. That's why we're keeping the clubhouse at 50%. Many of you are excited, like I am, to go to 75% and going to try to do it safe. Some of you think we should be at 100%, should have been some time ago. Believe me, we want to be at 100%, and I don't know when it's going to happen. We're going to continue to monitor this data and make the best decisions possible. A lot of data to go through. What are the key takeaways? We're trying to open, we want to open, and we want to stay open. And I know it's hard. We have fared incredibly well to date, but we're still in a battle. And I want to thank the partners who are not only taking the safety protocols here at work, but they're listening when they go home and being safer than the general population. And I certainly want to thank the residents. I want to thank them for their patience as we've had these things closed. I hope you're excited as we are that we're opening them up a little bit more. And that's the point of all this data. And I know that was kind of stark, so I'm going to turn it over to Ross now, and he's going to talk about some fun things like Thanksgiving and some opportunities in dining. Ross?
Thank you, Dan and Mary. Good morning, everyone. It's been quite some time since we've had a chance to talk with you directly. I did not intend to disappoint you, but I do not have slides this morning. I just wanted to have a candid conversation with you about 4 key topics, and I'll try to be brief on those. The first one is I just want to take Dan's comments about expansion to dining into a bit more granular level. Secondly, I want to talk to you briefly about the holiday, the Thanksgiving meal. Thanksgiving is on November 26th this year. Thirdly, a couple of brief comments about continued focus on safety. And then finally, I have a couple of remarks about some additional opportunities that lie ahead in the world of dining operations. So first, on the topic of expansion, as Dan indicated, we're moving from 50% to 75%. This applies to both campuses, both the original campus and to Moorings Park at Gray Oaks. This is merely a continuation of our planned reopening process. We recognize and appreciate that all pertinent factors related to COVID-19 in our area are very applicable, but we also believe that even under the current circumstances, additional occupancy in the dining rooms can be brought online in a safe manner. So commencing today is November 2nd, we will open dining venues to 75% capacity at the original campus, with the exception of the clubhouse. In the clubhouse, for those that feel a little more comfortable with some additional space between tables, we will maintain that environment at the 50% occupancy, and we also provide this opportunity for our residents at Gray Oaks. As far as the period of time that will continue the 50% occupancy in the clubhouse is currently undetermined. This move, going to 75% occupancy, should favorably impact our reservation process. Now, I understand that the reservations have been public enemy number one. It has been very difficult for many of our residents to obtain reservations, particularly for the trio. However, only 100% occupancy, in other words, restoring our restaurants to a pre-COVID environment, will provide the greatest latitude for obtaining the desired location to dine and also the time to dine. I want to talk momentarily about Moorings Park at Gray Oaks. The 105 and the Vines Restaurant will also partner with the original campus and go to 75% occupancy. However, because of the dining schedule over at Moorings Park at Gray Oaks, they'll go ahead and institute this process on Wednesday. I'm also pleased to announce that the Sandwich Bistro over at Moorings Park at Gray Oaks, which has been closed for essentially the period of March all the way to current, is finally opening, and that opens today on Monday, and that will be open for lunch. So we're really excited about this, and I can only imagine the residents at Gray Oaks are as well. On to the subject of Thanksgiving. So it goes without saying that 2020, I think Mary said it best, we're eager to see 2020 move on. It has been anything but routine. We've endured a pandemic that is witnessed typically only once per every 100 years, and it certainly continues to be at risk today. But there is also much to be thankful for, including the overall health and safety of the residents, extended family, and partners that Dan went into detail on. We're both pleased and eager to present to our residents the Thanksgiving meal for 2020. Now, most of what I'm about to pass on has already been reported to our residents via memo and posted on the applicable websites. Nonetheless, I would like to highlight a couple of key factors. Thanksgiving falls, as I mentioned previously, on November 26th this year. At the original campus, our dining team will serve the holiday meal at the clubhouse and also at the Trio restaurant. This will be done between 11:30 in the morning until 3:30 p.m. So please make your reservations either via Resi or a simple phone call. Either one will work, and we'll go ahead and get you booked. Due to the continued threat of the viral spread, we are unable, unfortunately, to invite family members, guests, into our dining venues. However, as an alternative, individual meals can be provided to one's residents for up to 6 people at the original campus. Because the kitchens are staffed differently, Mornings Park at Gray Oaks will either be able to do 6 people in their home or perhaps even slightly larger parties than that. Now, I understand that this doesn't replace the atmosphere of restaurant dining, but just dining with family in a relatively small group brings really a special value considering everything that our residents, our partners have been through. Like my previous remarks, we can seat up to 75% capacity, and then on Thanksgiving Day, in the clubhouse, which we're normally going to run at 50%, that day and that day alone, we will go ahead and elevate that to 75. Why? Because we want to be able to seat as many people who desire to come to the dining rooms as possible on Thanksgiving Day. Mornings Park at Gray Oaks will run these same very hours in the 105 and also the Vines. And they will also have the opportunity to have individual meals prepared, and they can be picked up just outside of the 105 dining room, and they can be taken to their apartment homes for enjoyment with their families and friends. Thirdly, I wanted to talk about the issue of safety momentarily. Dan talked about a slight uptick. He talked about some benchmarking with NCH Hospital, positivity rates nationally in the state of Florida and even down here in Collier County. Our resident cases here throughout Mornings Park Institute are extremely rare. You also heard Dan talk about an incredibly low positivity rate even for those partners that we have as part of our institution. This success is largely due to the proactiveness from the beginning as well as our measured approach for reopening. We've also seen much lower numbers within the Institute because our residents and our partners have been diligent with exercising precautionary measures. This includes wearing a mask, maintaining distance, washing hands, and even self-isolating when necessary. All that being said, I do want to share with you that we remain in a vulnerable state for 2 reasons. One is driven by sheer science. The other is an actionable issue. Let me explain. It goes without saying that science has told us this virus is still alive and well, and it's still a great risk, particularly those with underlying health conditions. But the second issue is one of vulnerability. Whenever things go on for a lengthy period of time, there's a sense of fatigue, and fatigue drives complacency. We haven't witnessed that here at Mornings Park Institute, but we're vulnerable. We're human beings, and we get tired. Dropping our guard at this current state would really be placing all of us at risk. So I encourage all of our residents, all of our friends and family who come to visit the campus, all of our partners, to continue to comply with all of our precautionary measures. Something that we're doing in our dining rooms, just to add an additional step of safety, is we're in the process of putting up plexiglass barriers. These will be placed wherever there is bench or banquette seating because people are so close to each other back to back. I understand that there's no one issue that's a silver bullet during this virus, but this is just one more step that we're taking at Mornings Park Institute to create an even safer environment. The last thing I wanted to mention under safety that I haven't brought up in a lengthy period of time. If our residents do have any signs or symptoms of the COVID virus, and let's go back and revisit what those are. Coughing, particularly a dry cough, a low-grade fever, a sense of fatigue, a loss of smell or a loss of taste. These are most common associated with getting the virus. If this does happen, please contact your executive director. We're going to maintain your confidentiality, and we're going to help guide you to the right resources as quickly as possible. I doubt seriously that there's any other resource out there that can help get you tested faster than Moorings Park itself. So please, stay in close communication with your executive director. Finally, number 4. We're only starting to get our feet planted with the dining operation. We also recognize that dining is arguably the #1 satisfier for our communities. Our hope is that the residents practicing these safety precautions do take advantage of restaurant dining. We do not yet have a date certain when we will go to 100% occupancy. It could take some time. We're going to monitor all of the benchmarking data that's available. Nonetheless, business must continue, and therefore our Unidyne partners are continuing to review and capitalize on areas of strength while simultaneously scrutinizing the areas of opportunity, particularly those areas that you have given us feedback on. Recently, a new executive chef, Wendy Rennie, was named as the leading culinarian to run our team over at Gray Oaks. Now, many of you on the original campus remember Wendy when she operated the kitchen at Trio. We're delighted to have Wendy come back and join us again, and she's going to be, again, running as the senior culinarian, the executive chef over at Gray Oaks. At the original campus, we look forward to some relief with reservations and somewhat newer vision for the Park Grill. While limiting the number of dining events per week at the Trio was a necessary step for reopening and continues currently as a necessary step, it by no means is a long-term solution for operating the Trio. It is not desirable for our residents nor for Moorings Park to limit the number of times that you can visit your favorite restaurant. We are looking at ways to elevate the evening dining experience at Park Grill, starting with a highly trained executive chef, premier entree selections, and additional staff training are also in order. We are also looking at ways to make this a bit more intimate in the Park Grill environment. The lunch experience seems to be going well, and we remain focused on a very casual setting. Wholesome entrees, variety, relatively fast service. Dinner, however, is different. We're eager to move forward with this vision at the Park Grill, and we'll be certainly talking to our food and beverage committee members about these actions. This concludes my remarks. I do hope you have a joyful Thanksgiving, and also you remain very safe. Thank you. Back to you, Dan.
Okay, thank you, Ross. I know it's a holiday season because I'm seeing the Hallmark commercials, and I know the movies are on now. So I'm going to end, after a lot of tough data here, with things that I'm thankful for. Obviously, thankful for our safety record to date. I'm thankful that the vaccine is being produced. And, we didn't really talk about this today, but Moorings Park has been lobbying for quite some time now to be an early receiver of the vaccine. I think many of you know that it's being manufactured. We're waiting on the final testing results. But we have, in fact, already filled out our application, and one of the first ones to do so in order to have the vaccine delivered here to Moorings Park when it comes. Obviously, at this time of the year, as the holidays roll around, I'm thankful for family. Many of you know Michelle. She has not been on this campus except for one small time since February. She likes to come here, as you guys all know, a lot and volunteer, both in Orchid Terrace, the Chateau, and over at Oakstone. That has not been happening. She was able to come on campus last week for the first time, social distance, and deliver a nice thank you basket to Lily L'Esperance, who is completing 38 years of service here at Moorings Park and retiring. So I'm thankful for my family, thankful for Lily, thankful for the future at Orchid Terrace as Ross Celeste and the team provide new leadership over there. I'm so thankful for the partners. My goodness. This thing has gone on and on and on. You've been great. You've worked hard. You've followed all the safety protocols, and the testing results show it. Thank you so much. Thankful for these two on my side here, Ross and Mary. Incredible leadership all the way through this. Keep it up. We're so thankful for all you're doing. And then finally, I have to thank you, the residents. A lot of different feelings about this COVID-19 virus, but all the residents of Moorings Park have taken the high road, whatever they believe, in consideration of others. We've put these things on, we've taken care of ourselves, and we've been patient as we slowly open. So with that, happy holidays to you all, and thank you for all that you're doing.